Hey everybody, welcome back to the channel. This is our EKG of the day. If you enjoy this content, please subscribe for more, and let's get going. So first thing I like to do when I look at rhythms is just take a look at the overall idea of what's going on here. I call it looking at the forest, and the trees of the forest are my QRS complexes. And so I'm going to look here in V1 in this rhythm strip down here at the bottom, and I see I've got this somewhat wide QRS that is occurring very regularly. I quickly notice just as I scan through the leads that I'm getting these spikes in front of my QRSs, and these are pacing spikes. And because they're occurring in front of my QRS complex, I know that they are ventricular pacing spikes. And so that makes sense that these ventricular pacing spikes would create a wide complex QRS, because as it's pacing the ventricles, it is going to not depolarize the ventricles from the normal His-Purkinje system. So starting to put together, this patient is definitely being V-paced. And so that actually helps make things a little bit more simple for us as we evaluate this patient, because for one, we can figure out that this rate of ventricular pacing, we can see this pacing spike lands right on this solid line. So we can count 300, 150, 175 beats per minute is the rate, and you can see all these spikes continue to land right about on that solid line. So this ventricular pacemaker is pacing perfectly regularly. So now, really what we need to do is figure out, what is the atria doing? I know what the ventricles are doing, but what is the atria doing? Is the atria being paced? Is this a sinus rhythm? What's going on? And this is a difficult EKG. We've definitely got some artifact here in lead 1 as I look for my atrial activity and some of my limb leads. That's going to be a little bit hard to do. I really like to look at V1 for my atrial activity. And you can see V1 out the gate. We've got these spiky atrial activities that appear to be somewhat before our pacing spikes. So I wonder, is this an atrial sensed ventricular paced rhythm where the ventricles are being synced to the atrial activity? And so this may be in V1 up here, might not be enough time for me to help determine that. However, let's go down to my V1 rhythm strip and see what we have. So I start here. I see I've got P wave, P wave, P wave, P wave, and as I'm looking, it looks like the PR interval at first was normal, but now it looks like it's getting longer, right? From the time that that P occurs to when that ventricular pacemaker fires off. And it gets longer and longer and longer until this last one, there's another one that occurs just before the pacing spike. And so that makes me wonder, is this atrial P wave that I'm seeing, is that just a sinus atrial activity, or is there some type of underlying atrial tachycardia going on, and this pacemaker is just pacing the ventricles consistently at 75 beats per minute despite of that? And so I think that's what I'm seeing, because I see all of a sudden, if I look back, I'll erase this drawing. If you look really closely, I'll actually erase both of these. What I'm noticing in V1 is I'm seeing, this is my T wave, but I'm seeing this spiky on top, spiky. You can see the beginnings of one just before that QRS. Then you've got another one there, you've got another one there, another one there. You can see one right at the end of this QRS. You know that's one because it doesn't occur with our other QRSs. And so you can follow this atrial activity throughout. Obviously, sometimes they're going to be buried in the QRSs, but for the most part, you can see there's an underlying atrial tachycardia that is plowing through this EKG, and our ventricular pacemaker, or our ventricular pacing, is not occurring in any particular fashion in accordance to these atrial waves. The pacemaker is just pacing the ventricles, so it's not syncing with the atria. And so, what is my differential diagnosis for what is going on in the atria? And you can see these waves just ticking along. You could say this is either, the rate of these atrial waves here is just slower than 300 beats per minute. It's probably 280 beats per minute. And so those are my P's, 280 beats per minute. So the first thing that comes to my mind is atrial flutter. That's an option. This could be less likely, but like an ectopic atrial tachycardia. And it would be easier to help determine if it was a flutter. There would be, if it was typical flutter, I might be able to see some flutter waves in these inferior leads like we typically do. But I don't see any good flutter waves there. And so, this is one of those diagnostic dilemmas where you might not be able to tell exactly if this is ectopic atrial tachycardia versus atrial flutter. So, what I urge you to do is to, for these patients, look at previous EKGs, determine what their medical history is. Do they have a history of other baseline EKGs? Because this person has not had a pacemaker forever. And so sometimes you can kind of decipher what is going on. So in this case, what I would diagnose with this EKG, and remember EKGs are always only have so much utility, I would say that we've got some type of atrial tachycardia. You could say a flutter versus ectopic atrial tachycardia with ventricular pacing at 75 beats per minute. And so I hope this helps just get an understanding of what's going on with this person. When you have them in front of you, you can add this to their clinical scenario. Are they perfusing? Are they having strokes? Or what is the signs and symptoms that you're looking for? And then it can really help you figure out, is this rhythm contributing to their symptoms? So I hope that helps. Have a great day.